computer. Now it is. Thank you, Ariel. So there's no generic rounding rule, and this is going to apply more to the upcoming sections. We're going to start calculating some drips and dosages and IV fluids and piggybacks, and so here we are. And these rounding things, they're not negotiable because there's a big difference between 1.2 versus and 1.25, especially when we're talking about pediatric medications. So let's talk about some IV fluids. Calculations of basic IV drip rates. It's my mouse. So there's different types of IV fluids. I know some of you are techs, CNA. We might even have some paramedics here. You know your IV fluids. There's a couple of examples here: D5W, D5NS. Oh, that's a typo. D5.5 NS, half NS. There's many. If you go to a supply room of a hospital, there's a lot of them. And I'm not gonna go over which is what is for who's for what. Your Pharm 1 instructor or MedSurg 1 professor will go over these with you. But for now, IV fluids. We're gonna learn how to calculate them. And one thing that you need to know for these IV fluids is there's a lot of information on them. What you need to know is the expiration date. Takeaway is the expiration date, because obviously we cannot give somebody a patient with an expired medication. These are considered medications. Oh, I also have a if you don't know, now you know moment. When Hurricane Dorian devastated Puerto Rico in 2019, did you know that most of our IV fluids come from Puerto Rico? We did not know that either. America did not know that. So there was a shortage of IV fluids. So ever since then, they rebuilt Puerto Rico, and they also made IV fluids factories all over the US, so that doesn't happen again. So it was a shock to all of us, that most of us, that there was a Puerto Rico supplied IV fluids for America. We don't even know, probably the rest of the world. All right, drip chamber. Now let's get to the IV fluids. If you've never seen an IV, if you've been in a hospital, you know somebody who has an IV infusing, you're gonna see this little chamber you see on the screen. This is the drip chamber. This is where the magic happens. This is how we are going to calculate how much or how much to give our patients. All IV fluid infusion kits come with this drip chamber. And we will be calculating these, the flow, how much the patient is gonna get based on the number of drips. We actually look at these numbers. If you look at the screen, I'm just gonna guess, it's probably dripping once every second. So this is 60 drips a minute. And that's how we do it. Not just by eyeballing. And also when you get to the hospitals, there's machines, IV pumps, different gadgets that control these things for us. But for testing purposes, NCLEX purposes, and also when these machines die, we still need to know how to calculate these, learn how to do the drips. What you need to know is the drip factors. To calculate the IV drips, these numbers you see on the screen, it will be given to you. Micro drips, 60 drips per ml, and macro drip, 10 or 15 drips per ml. This is a vital piece of the operation for calculating IV drips. So what are these macro and micro drip sets? Micro drip to the right at 60 drips per minute. As you can see, the drips are very, very small. This is when we're trying to infuse a small amount of fluid into the patient. It's very difficult to calculate drips on the micro drip sets because they're tiny. You can't see them. On the flip side of that, you have the macro drips. It's when we're trying to infuse large amounts of fluid to the patient. We're talking about 100 mLs per hour. I mean, 100 an hour. Maybe we're going to need to give our patient 500 bolus, 1,000 bolus. This is what we will be using. And it's right here. It's on the packet. So if you grab an IV tubing in the hospital supply room, it will be right there. It will tell you what the drip factor is. On the left is 10, on the right is 60. Let's talk about some terminologies. These all mean the same thing because you're going to see them. Drop factor, drip factor, GTT factor. If you don't know what GTT is, it's drip. Tubing drip factor. However, the book, the test, me, whoever refer to it, it's going to be any of those. They all mean the same thing. The thing Henke uses the term drop factor for calculations. IV tubing label. And there's not much to talk about here aside that this is a Joint Commission's requirement that all tubings must be labeled. You're going to see this in the hospital, and depending on the medication in the hospital you're in, some tubing expire and you have to change within 12 hours, some within 72 hours. I know some medications, propofol, a sedative, the tubings for that needs to be changed every 12 hours because of the medication changes the messes with the tubing. You'll get to that when you in your critical care rotation. All right, now IV fluid orders. This is what for an IV fluid order, you need parts. You need to know the name of the IV fluid, amount to infuse, and the number of hours to infuse. Example is 100 mLs of normal saline to infuse at 100 mLs per hour for 10 hours. Fairly straightforward, but most of the time, some of the parts are missing. So it is up to us to calculate what's missing. Maybe the physician ordered 100 ml, 1,000 ml of normal saline to infuse at 100. How long is that going to run? Okay, then we have to do a little bit of calculation. And this is where we're going to talk about here. We're going to learn. And then when you get to your clinical setting, I can speak for Valley Health System. The computer, the Cerner, the EMR controls the IV pump for you. So, but then again, it works majority of the time. So if it doesn't do that, then you have to manually enter it. Pretty cool technology that Valley Health System implemented. You will see that when you get to your clinical site. Pediatric IV pumps also exist. These are highly as precise as it gets because we're dealing with little babies in micro dosages. Next is IV piggybacks. I have this whole video clip of IV piggybacks, but I'm not really gonna focus on it. What you need to know is to the left is an IV fluid infusing, and to the right is my IV piggyback. Normally it's antibiotics. Typically it's antibiotics. What it does is I'm gonna piggyback the antibiotics, which is B, into A, so I can infuse this medication into my patient. And when it's done, I don't have to do anything with the pump. The IV fluid, which is A, will continuously run. I had this video, but I'm not going to show it because this is something you will be checked off to when you get to the skills lab. So you have this video clip. We'll skip that because they're going to go over it. Maybe I'll be your skills lab person and I'll explain this to you further. It's best learned hands-on. Okay, we can skip you, buddy. All right, now let's do some calculations. This is the meat and potatoes of this. So when we're calculating IV fluid infusions, we're looking for any of these three. I need to know the drips per minute, or the flow rate or drops per minute, the number of hours the infusion is going to last, and more importantly, the volume per hour. How much are you as a nurse going to set the IV pump to run for this X medication? And it's so when a physician orders, let's say, vancomycin IV, give it to the patient over an hour, they're not going to tell you to run it at 200 an hour, 500 an hour, or however much an hour. It is up to you to calculate how much to program the pump to give it to the patient. So now you need to know how much mLs per hour to set your pump. Critical part of this nursing job. Let's start with this. A couple of what is this? This is the if I need to calculate the drops per minute or drops per minute, here's my formula. The mLs per hour times the drop factor, which will be given to you, and the number of minutes to infuse. Fairly straightforward mathematical formula. Plug in some numbers, and that's it. That's all you get. But when the order reads hours, you have to convert it into minutes by multiplying it by 60. Okay. Let's try one. The order says 100 mLs of D5W at 120 an hour. Available macro drip is 15 drips per ml. What is the drip factor in drops per minute? And here it is. Boom. When I'm calculating, doing some any type of calculation, I like to write out my formula. So my order, 1,000 ml of D5W at 120 per hour. Okay. Available. I guess I'm rewriting what I had upstairs. Available is at micro drip is at 15 drips per ml. Let me fast forward this thing. I need to write faster. So what is the drip factor in drops per minute? Why did I do this? Why did I just rewrite the question? First thing I do is I like to write my formula. Number of mLs per hour times my drop factor over 60, which is the formula. Number of minutes, which is 60 for the 1 hour. Come on, let me write faster. All right, let me do this. So from here, I will simply plug in some numbers. 120 an hour, okay, times 15 drips per ml. That's my drop factor over 60 minutes. Cross off my mLs, 120 times 15 equals 1,800 drips over 60 minutes, which will give me 30 drips per minute to answer this question. Next. Now we need to determine how long will this IV run? Is it going to run for 10 hours, 24 hours, 18 hours? I don't know. So let's calculate that. Here's a problem. The order says 1,000 ml of normal saline to infuse at 100 mLs an hour. Okay, let's do that. number of here's my numbers, mLs ordered over number of ml per hour, which will tell me how many, how long this infusion is going to go. So 1,000 ml over 100 ml will give me 10 hours. It seems simple. It seems straightforward. You can probably eyeball this, but calculate it because it's going to get a little technical as we move on. Next. Now, that's calculating the flow rate in drops per minute. Here's your question. The order says 1,000 ml of normal saline IV times 100 mLs an hour. Available micro drip is 15 drips per ml. So there's my formula, mLs per hour times drop factor over 60 minutes. That's the hour. I'm going to fast forward it again because I am just plugging in numbers. mLs per hour is 100, as you can see from up top. My drop factor is at 15 drops per ml and 60 minutes. Simple math, I'm crossing off my mLs. 100 times 15 is 1,500 over 60. And there is my answer. 25 drops per minute. So far there's nothing complicated. I'm plugging in numbers. I have the formula, which you will have the formula and all the information you need for the formula. It's on the question. Let's do it again. 1,000 ml normal saline. No, this is the same thing. Okay, now this is your job as a nurse. You need to calculate the mLs per hour to set on the infusion pump. So there's the formula up top. Total numbers of mLs ordered and the numbers of hours to run, which will give you your mLs per hour. Because for the IV pumps, you can only set it per hour. There's no minute or second settings on the IV pumps. There's my formula again, because I like to write it when I'm calculating something there. And then from there, total number of mLs ordered. Oh, I forgot to write the question, but it's 1,000 ml, number of hours to run. It's 10 hours. So I will be setting my pump at a little bit of division, 100 mLs per hour. Oh, there, I guess I clicked the thing wrong. Okay. So the micro drip is there, but you don't really need it for this calculation. Let's do another one. How many hours will 500 ml of D5 half NS run at 75 an hour? So there's that thing again. There's that thing, round to the nearest whole number. Okay. Every question, most questions that requires rounding will be specified on the question. Total number of mLs to be infused is 500. At 75 mLs per hour. Simple division there, cross off my mLs, which will give me this thing, this IV is going to run for, come on. I'm just trying to calculate it. 6.66 hours. But that's not the final answer. If you look up top, round to the nearest whole number, you guys know the answer from here. It is 7. Okay. And this is, just keep that in mind for testing purposes, the rounding. Ooh, This one's a little complicated. There's a lot of stuff here. The order is normal saline, 1,000 ml every 8 hours. Drop factor is 15 drips per ml. How many mLs does the nurse administer the IV? Do the nurse administer the IV? Round to the nearest whole number. I don't know. Round to the nearest whole number. And there it is. Come on, play. Here's my formula to get the mLs per hour. Oh, the formula method, I mean. Did it 2 ways. The formula method, I have 1,000 ml. I need to infuse it over in 8 hours. So 1,000 over 8, which will give me, why is mine slow? 125 mLs. 125 mLs. Well, I can only also do this the other way around. The other one, ratio and proportion, the algebraic way. As I've said before, you can do this many, many ways, and it's up to you. It doesn't matter to me, as long as you get to the right answer. As long as you give my patient the right infusion. So from here, I'm doing algebraic. Oops. 1,000 ml over 8 hours equals X over 1 hour. There's my basic algebra, cross multiplication, X over 8 hours. Then you know I have to isolate the X. 100 ml over 8, which will give me the same answer, 125 mLs. I sent you a copy of this file, so when you are trying to work out something and you need to look back, you have it. This is the same one. What is this? So adding medications to IVs, math intermissions. Sometimes we have to dilute a medication before we can administer it. Sometimes a medication will come in powder or concentrated liquid form. And it is up to you to dilute this medication. Most of the time, it's going to come with instructions on how to dilute it. And also sometimes it's going to come with a little vial of fluid to infuse it with. So check the dose. And this is also something you will do a lot when you get to the hospital. And when we're calculating drip on these IV piggybacks, the IV piggyback drips does not apply to the IV fluid infusion because it's separate. So I'm not going to ask you, or you don't need to learn how to know, at least for now, how to calculate these strips. All right, let's get back to the math, back to the IV infusions. Here's another one. The order is 100 ml of D5-LR to infuse in 8 hours. I have a drop factor of 20 drips per ml. Calculate the IV flow rate in drips per minute and round to the nearest whole number. Everything you need to know, everything you need is in this equation, in this problem. The formula way, ml to hour. Step 1, I need to calculate, I need to convert my, I need to find out my mLs per hour. mLs hour to infuse times the drop factor. There's my formula, because I like to write out my formula first. So first step, I need to find out my mLs per hour before I can, because if you look at my formula up top, it's calling for mLs per hour. So 1,000 ml over 8 hours will give me my 125 mLs per hour. Now that I have my 125 ml, I can plug it in to my formula up here. 125 ml times the drip factor over 60 minutes. Some multiplication there, 2,500 over 60 minutes will give me my 41.66 drips per minute. But remember, look at the question up top, round to the nearest whole number. So my answer for this one will be 42. So looking back, there's my formula to get my drips per minute. I don't have the parts, I don't have the mLs per hour here. So I had to calculate that first, which is the 1,000 mLs over 8 hours. And then I can simply plug it in. Let's do another one. 500 mLs D5W to infuse in 4 hours. I'm going to do the same thing. I'm changing the numbers so you can see how it works. Drop factor, 15 drips per ml. Calculate the IV flow rate in drops per minute. I'm writing my formula again. It's the same exact formula over 60 minutes. Step 1, I need to find out my mLs per hour. I don't know what that is. So I am going to take my 500 over 4 hours, 500 ml over 4 hours. And that's going to give me, it's the same, 125 mLs. Okay. Now that I have that, I can plug it into my formula up top. 125 mLs times the drip factor over 60 . Do a little bit of math. I'm going to cross off the mLs. That will leave me with drops per minute. Don't know why it's taking so long. 125 times 15 is 1875 over 60. I think I was also calculating at the same time. That's where there's a pause. 31.25. Remember, I have to round to the nearest whole number. So I have 31 drops per minute. All right, next one. This is a little different. A different problem. Order is NS 500 ml over 30 minutes. Oh, the question is, you as a nurse, what are you going to set the pump to? 500, 200, 100. It's up to you. So let's calculate this. How are you going to set the pump and round to the nearest whole number? I think I did it 3 ways here: the formula way and the formula way. I'm going to fast forward this. 500 mLs times 30 minutes times 60 is 16.66 times 60 minutes is 1,000 ml. Okay, well, we can watch me work out the ratio and proportions here. But if you step back on this question, 1,000 ml per hour will infuse this 500 ml to the patient in 30 minutes. Okay, so if you get an answer like 100 ml an hour to set this, to deliver this 500 ml, you can step back and say, that doesn't sound right. So you may need to work it out again. So I'm doing it here algebraically. 500 ml to go in 30 minutes equals X, which I don't know, to go in 60 minutes. Cross multiplication. And it should give me the same answer of 1,000 ml. I'm also going to do it here dimensional analysis way, so you can see, you can pick from here, you should be able to, you should pick which one you can stick to. So this is 500 ml to go in 30 minutes. You can do that too. Hey, it doesn't matter to me. As long as you get to the right question. Yes, you can do that, Bailey. See, 500 over 0.5, you can do that on the top of your head, off the top of your head. I'm showing you different ways you can do it. Here's another one, gentamicin. Let me tell you guys a secret. When I'm giving you a drug, gentamicin, vancomycin, steroids, I don't know, ivermectin, whatever the medicine is, it doesn't matter what the medicine is. We're trying to calculate the flow rate for this for the medication. So don't get bogged down with the name and the terms you see on the question. Same over here, gentamicin 300 milligrams IV piggyback. But it comes in a 300 milligrams in 50 ml of D5W to infuse in 30 minutes. Ooh, some of you probably already did it in your brain. How many mLs do you need to set the IV pump to administer the gentamicin? So regardless of whatever antibiotic this is, I have 50 ml that needs to go to the patient in 30 minutes. And I can only set the pump per hour. This looks like simple math if you just, you can do it in your brain. Most of you probably did it in your brain, but I'm showing you calculation, different ways you can calculate it. Algebra, my preferred method. The simplest method is the ratio and actually it's the dimensional analysis. Too many steps here for the algebra. And 100 ml. Dimensional analysis, the simplest, easiest way to do it. I keep telling myself I'm going to skip the rest of these and start doing it this way. But I kind of made this thing a while back. So dimensional analysis, I have 50 ml. I need to give it over in 30 minutes. And the pump, IV pump can only be set for 60 minutes. Let me cross off my minutes there. Cross off the minutes. Let me do some, I did some reduction there, 30 to over 60. 50 times 2 is 100 ml. See kind of how simple the dimensional analysis was. Next. Oh, solving. Now it gets, it's throwing a little bit of a curveball at you now. Solving for mLs per hour when only the following are given: drops per minute and drip factor. Okay, so now you know you have to do a little bit of conversion before you get to the you get to calculate it. Let's see how here you go. Step 1. Calculates ml per hour. Since I need to be working in hours, not in minutes. If you look at my my order, it says drips per minute. I need that in hour. So what am I going to do? I need to multiply it by 60 because 60 minutes is 1 hour. There it is. I'm doing it now. 60 minutes, 1 hour. There's my, okay, so cross off my minutes. Cross off my minutes. Come on, there we go. Do some multiplication, and I now have 1080 drips per hour. Now that I have my drips per hour, I can solve this. Let's solve it. 1080 drips per hour. Okay. 1080 per hour. Okay. Multiply. I'm going to multiply this by my drip factor of 1 ml per 20 drips. And there we are. Cross off my drips. Do some simple math there, 1080 over 20, which will give me 54 mLs per hour. So for this specific question, I will be setting the IV pump at 54 mLs per hour. You have this in video. I sent this to you so you can go back and see it. Use it as a reference. Here's another one, mLs per hour. Same thing, different numbers. I need to convert my drops per minute into drops per hour. I'm going to do the same exact thing as the previous question. So I'm going to take my 18 drips per minute, multiply it by 60 for 1 hour. Oh, I did it the other way. Oh, we don't, it's the same question. That's all right. We'll skip this one. Same question, different. I think I solved it 3 different ways, which I'm going to start solving it this way. Dimensional analysis. I'm not even going to show you the other ones. I'll delete all those. Okay. So dimensional analysis, I'm going to set it up. I have 18 drips per minute, 18 drips per minute. I have to convert it into hours, so I need to multiply it. 60 minutes is 1 hour. Oh, I also need to plug in my drop factor of 1 ml per 20 drops. All right, let's cross off some numbers here. I'm crossing off, oh, I did some reduction there. 20 to 60, 1 into 3. I'm crossing off the minutes. I got to cross off the drips. I'm going to be left with mLs per hour. Cross multiplication. That's supposed to be 18 times 3 over 1. And it's going to give us the same number, 54 mLs per hour. All right, one more time. Another one. I think I'm going to skip this one. 25. I don't want, there we go. I want this one. Same question, different numbers. I need to solve for mLs an hour because you need to know how to set the pump on my IV pump, because you get to decide what to set the pump at. And that's infusing at 25 drips per minute. There's my setup, 25 drips per minute. I got to convert this into hours. So I need to multiply it 60 minutes over in 1 hour, okay, which is 60 minutes, 1 hour, and 1 ml per 10 drips. That's my drop factor. There we go. I'm going to start. Oh, I did some reduction there. Oh, I did my 6 in, it's supposed to be 6. Crossing off like terms. 25 times, this is, I kind of hit a roadblock here because I wrote 1 there instead of 6. 25 times 6 over 1 hour. So I will be setting this IV pump at 150 mLs an hour. There's lots of text there for calculation. Let's do another one. So you have to do this over and over. You need to, because you need to know this, not just for this test, all throughout nursing school and all throughout NCLEX. This is the starting point. So here's another one. I have acyclovir. If you guys remember, don't care what the antibiotic is. Acyclovir, 100 milligrams IV piggyback, at least for now, we don't care. In 150 ml NS to infuse in 2 hours. So now I have 150 ml in 2 hours. I gotta convert you into minutes because it's asking for drops per minute. So the last one is my drop factor of 60 drips per ml. I'm gonna start crossing off some stuff here, reducing 60 mLs like hours to hours. So now I'm left with drips per minute. Let's do some cross multiplication here. Oh, I also simplified my 150 over 2, which kind of took me to the answer of 75 ml drips per minute. Forgot I was looking for something else here. I was looking for drips per minute, not mLs per minute. Okay, same theory. So this is, I think we're done with the math. And this is the dilution thing I was talking about earlier. There's going to be this powder stuff here this person is holding, and it's going to come in the bag. So when you're giving this medication to the patient, you will be calculating how much is in this bag. Okay. There's different types of bags, different types of solutions based on a manufacturer, but this is one of the more common ones you will see in a hospital. You have to plug it in and activate it. Another thing is enteral nutrition, tube feeding. Some of you, I don't know, may work in a nursing home. You see some patients with a PEG tube coming out of their stomach, and where you're giving them food through there, some medications through there, or also sometimes a lot of times in the hospital, patient had a stroke and they can't swallow, they can't eat. So we give them an NG tube up their nose to their belly, which I think you're going to learn how to do that next semester. And so you also need to learn how to calculate the mLs an hour for their nutrition. But I'm not going to go through that because it's something we will do next semester in the lab. It's part of your checkoff. General guidelines for continuous IV medications. Most IV dosages are based on weight in kilograms. I think I just said this in the first few weeks of class that we don't normally use pounds in the hospital setting, especially for drug calculations. Always use infusion pump or volume control sets in the hospital settings. We don't do manual IV infusions anymore, except in the ER. We do manuals in the ER because it's mainly for time purposes, because my patient needs my patient's dying. They're about to code, and I need to give this patient a bolus, 1,000 ml of bolus. I'm not going to run around the unit, the ER, looking for an IV pump. I'm going to plug in my IV tubing, connect it to the patient, and let it roll, let it run. We don't have time for that. Is it ideal? No. I'm trying to save a life. So what they do in the ER and the book are two different things. Because life-saving, it kind of changes things a little bit. Small bags of fluid are used to prevent fluid overload. You will learn about this in the when you get to Med-Surg 1 about CHFers. I mean CHFers and your renal patients that we don't want to give them too much fluid, or they're gonna be in more trouble than anything. So that's into consideration. There's also another thing you're going to learn is protocols based on facility, because I have Sunrise Hospital here may have, actually they do have different protocols than your Summerlin Hospital. You have HCAs in town, you have a Valley Health System, you have UMC and VA, St. Rose, 5 different hospital systems in town. For the most part, most protocols are the same, but they're still different. So there's no generic rule for this. For pediatric, you're going to learn about this in pediatric. You're going to be tested on it. Pediatric drug dosage, they work in very in small numbers. Because as you can imagine, your patient weighs, I don't know, 5 pounds, 8 pounds. And who is that? Professor Tabor, and we'll be talking to you more about that in the upcoming semesters. And that's all I got for this week. You have this PowerPoint, so you can refer back to it when you're doing your dosage calculations. So far, nothing too complicated. Plug, 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 plug. It's right there. Okay. Here's your homework. We're almost done. Stay with me. Almost there. In fact, one of my other cohorts, we have 3 clinical days left. They're counting every minute. So you guys hang tight. Talk to Gene if you have any questions or on anything, or email me. Even though I failed Alex that one day, but text me. But don't email, text me, because I'll respond faster to that. Questions? If there's no questions, I will exit, save this, and upload it. 3-page for that? There's only a 3-page? Oh no, I sent it to you. It was download the PowerPoint I sent you with the link. I mean, with the attachment. Yeah, Bailey, that 3-page, that's probably some old stuff I didn't take down because I didn't think it was there. But yeah, use the stuff I'm sending you. Plus, I'm also going to upload this. All right, guys, have a good weekend and see you next week. Thank you. Thank you. You're welcome. Stop. How do I stop recording?